Hi everyone, and thanks for joining me. I want to talk about a headline you might have seen recently that has caused a lot of anxiety for parents. It claimed that a new study was showing children on ADHD medication had a lower quality of life. When I saw that, my heart sank. That kind of reporting is not just inaccurate, it's genuinely irresponsible. It takes a complex piece of research and boils it down to a headline that causes fear and worry. So today, I want to set that record straight and give you the real story. The real info is that this new Australian study did not compare children on medication to those who were not. It compared children with ADHD symptoms to those without them. The study found that children with ADHD do tend to have a lower quality of life. But that's a reflection of the condition itself and the fact that they're trying to navigate a world that isn't designed to support them. The evidence shows a correlation between ADHD and those challenges, not that the medication is the cause of them. In fact, the researchers themselves explicitly cautioned that the number of children taking medication in the study was far too small to draw any meaningful conclusions. Correlation truly does not equal causation in this case. Medication is just one treatment in our multifaceted toolkit. It's not character changing and kids are not locked in. It's always a trial to see what works best for them. This is a perfect example of why we need to move beyond the headlines and look at the actual science. And that is what my work is all about. The truth is we are at the beginning of a new and better era for ADHD care in Australia, driven by new Australian clinical practice guidelines. These guidelines are designed to create a more effective system, and we are already seeing them put into practice. The Brisbane Paediatric ADHD Collaborative Care Pathway is a fantastic example of a positive model for the future. It's a blueprint that brings care closer to home by empowering GPs to manage a child's ongoing medication and support while still having access to a paediatrician for timely advice. It's a system designed to reduce delays and ensure continuous quality care. This is a hopeful vision for all families across Australia, and it's a huge step towards making sure our kids get the support they need to thrive. I believe that empowering parents with evidence-based information is the best way to move forward. This video is just one part of that effort. If you want the full story on this study and a deep dive into how collaborative care pathways like the one in Brisbane work, I've written a detailed series of articles on my Substack, Kids Health Decoded by Dr. Matt. Links are in the description and pinned comment. You can find the full article and all our resources, including my Neurodiversity Roadmap series, on my Substack, YouTube channel, and my podcast. Let me be your guide from your first questions about ADHD or autism to diagnosis, treatment, and advocacy at school and beyond. My goal is to democratise scientific research and make it understandable for everyone, so you can make the best decisions for you and your family. Let's stay informed, not overwhelmed. Disclaimer: this is general advice only and not a substitute for personal guidance from your doctor.